Another day, another story. As researchers announce that bloodletting might have some benefits after all, find out more about this ancient treatment's long history. Several thousand years ago, whether you were an Egyptian with migraines or a feverish Greek, chances are your doctor would try one first-line treatment before all others: bloodletting. Welcome to Tabo Eminent Channel. The doctor would open a vein with a lancet or sharpened piece of wood, causing blood to flow out and into a waiting receptacle. If you got lucky, leeches might perform the gruesome task in place of crude instruments. Bloodletting, also known as phlebotomy, is the historical medical practice of withdrawing blood from a patient for therapeutic purposes. This practice has been used in various cultures and civilizations throughout history, dating back thousands of years. Here's an overview of the full history of bloodletting. Ancient civilizations. Ancient Egypt. Bloodletting was practiced in ancient Egypt as a way to balance the body's humors, fluids, and treat various illnesses. Ancient Greece. Greek physicians such as Hippocrates and Galen advocated for bloodletting to balance the body's humors, believing it could restore health. Ancient Rome. The Romans also adopted bloodletting as a medical practice, following the teachings of Greek physicians. Middle Ages and Renaissance. Islamic Golden Age. During the Islamic Golden Age, scholars like Avicenna, Ibn Sina, further developed the practice of bloodletting based on Greek and Roman texts. Medieval Europe. Bloodletting gained prominence in medieval Europe and was used to treat a wide range of diseases. Barbers often performed this procedure, and their red and white pole symbolizes blood and bandages. Renaissance. Bloodletting continued to be a common medical practice during the Renaissance, with physicians like Paracelsus supporting its use. 17th to 19th centuries. 17th century. Bloodletting reached its peak during the 17th century. Physicians believed in the theory of balancing the body's humors, and bloodletting was used to treat various conditions, including fever, infections, and mental disorders. 18th century. The practice began to decline in the 18th century with the emergence of scientific methods and the realization that many diseases were not caused by an imbalance of humors. 19th century. With the advent of modern medicine and the understanding of diseases and circulation, bloodletting fell out of favor among medical professionals. The invention of the stethoscope and advancements in understanding the circulatory system further discredited the practice. 20th century to present. 20th century. Bloodletting was almost entirely abandoned as a medical practice, replaced by more evidence-based and scientific approaches to medicine. 21st century. While bloodletting is no longer a mainstream medical practice, it is occasionally used in specific medical conditions, such as hemochromatosis, a genetic disorder causing excess iron accumulation, and polycythemia vera, a blood disorder. 2. In these cases, controlled therapeutic phlebotomy can be performed to reduce blood volume. In summary, bloodletting has a long and varied history, evolving over thousands of years and being practiced by different cultures and societies. Its decline in the modern era is attributed to advancements in medical knowledge and the understanding of diseases and the human body. Considered one of medicine's oldest practices, bloodletting is thought to have originated in ancient Egypt. It then spread to Greece, where physicians such as Erasistratus, who lived in the 3rd century BC, believed that all illnesses stemmed from an overabundance of blood, or plethora. Erasistratus also thought arteries transported air rather than blood, so at least some of his patients' blood vessels were spared his eager blade. In the 2nd century AD, the influential Galen of Pergamum expanded on Hippocrates' earlier theory that good health required a perfect balance of the 4 humors: blood, phlegm, yellow bile and black bile. His writings and teachings made bloodletting a common technique throughout the Roman Empire. Before long it flourished in India and the Arab world as well. In medieval Europe, bloodletting became the standard treatment for various conditions, from plague and smallpox to epilepsy and gout. Practitioners typically nicked veins or arteries in the forearm or neck, sometimes using a special tool featuring a fixed blade and known as a phleem. In 1163, a church edict prohibited monks and priests, who often stood in as doctors, from performing bloodletting, stating that the church abhorred the procedure. Partly in response to this injunction, barbers began offering a range of services that included bloodletting, cupping, tooth extractions, lancing and even amputations, along with, of course, trims and shaves. The modern striped barber's pole harkens back to the bloodstained towels that would hang outside the offices of these barber surgeons. As hairdressers lanced veins in an attempt to cure Europeans' ailments, in pre-Columbian Mesoamerica, bloodletting was believed to serve a very different purpose. Maya priests and rulers used stone implements to pierce their tongues, lips, genitals and other soft body parts, offering their blood in sacrifice to the gods. Blood loss also allowed individuals to enter trance-like states in which they reportedly experienced visions of deities or their ancestors. Bloodletting as a medical procedure became slightly less agonizing with the advent in the 18th century of spring-loaded lancets and the scarificator, a device featuring multiple blades that delivered a uniform set of parallel cuts. Respected physicians and surgeons extolled the practice, generously prescribing it to their most esteemed patients. Marie Antoinette, for instance, seemed to benefit from a healthy dose of bloodletting while giving birth to her first child, Marie Thérèse, in 1778, 14 years before the guillotine would shed more of the Queen's blood. As an excited crowd thronged her bedchamber, hoping to witness a dauphin's arrival, the mother-to-be fainted, prompting her surgeon to wield his lancet. America's first president was less fortunate than France's most infamous queen. On December 13, 1799, George Washington awoke with a bad sore throat and began to decline rapidly. A proponent of bloodletting, he asked to be bled the next day, and physicians drained an estimated 5 to 7 pints in less than 16 hours. Despite their best efforts, Washington died on December 14, leading to speculation that excessive blood loss contributed to his demise. Bloodletting has also been implicated in the death of Charles II, who was bled from the arm and neck after suffering a seizure in 1685. By the late 1800s, new treatments and technologies had largely edged out bloodletting, and studies by prominent physicians began to discredit the practice. Today it remains a conventional therapy for a very small number of conditions. The use of leeches, meanwhile, has experienced a renaissance in recent decades, particularly in the field of microsurgery. The barber-surgeon tradition. In medieval Europe, barbers often performed bloodletting alongside the usual services. Explore the life of a barber-surgeon, detailing the tools they used, the training they received, and the diverse range of medical procedures they performed, including bloodletting. Highlight the challenges they faced and the evolution of the profession over time. Royal bloodletting. Investigate the historical accounts of bloodletting among royalty. Explore how kings, queens, and other nobility believed in the healing powers of bloodletting and employed personal physicians to perform the procedure. Discuss specific instances where royal figures underwent bloodletting and the impact it had on their health and legacy. Bloodletting in traditional Chinese medicine. Contrast the Western practice of bloodletting with its counterpart in traditional Chinese medicine. Explore the ancient Chinese theories behind bloodletting, its methods, and the conditions it aimed to treat. Discuss how this practice has evolved over the centuries and how it is viewed in modern Chinese medicine. Bloodletting and famous historical figures. Explore how bloodletting affected the lives of famous historical figures. Investigate the medical treatments undergone by figures like George Washington, Charles II of England, or Marie Antoinette. Discuss how bloodletting influenced their health, decisions, and historical events, shedding light on the impact of this practice on significant moments in history. Bloodletting in literature and art. Examine how bloodletting has been portrayed in literature, paintings, and other forms of art. Explore famous literary works or paintings where bloodletting is depicted and analyze the symbolism behind these representations. Discuss how artists and writers perceived this practice and the cultural messages they conveyed through their creations. Bloodletting rituals and beliefs in indigenous cultures. Investigate bloodletting practices in indigenous cultures around the world. Explore the rituals, beliefs, and cultural significance of bloodletting among tribes and communities. Discuss how these practices have evolved over generations and how they are perceived in contemporary society. Each of these stories can provide a unique perspective on the history of bloodletting, offering insights into its cultural, social, and medical significance throughout different periods and regions. Bloodletting and medical debates. Explore the historical debates within the medical community regarding bloodletting. Discuss the arguments presented by physicians who supported bloodletting and those who opposed it. Highlight key figures in these debates and how their views shaped the practice of medicine during their respective eras. Bloodletting and alternative medicine. Investigate the resurgence of interest in bloodletting within alternative medicine practices. Examine how some alternative medicine practitioners incorporate bloodletting techniques into their treatments and therapies. Explore the controversies and debates surrounding these practices in the context of modern healthcare standards. Bloodletting instruments and innovation. Delve into the evolution of bloodletting tools and instruments throughout history. Explore the different devices used by physicians, surgeons, and barbers for bloodletting procedures. Discuss the technological innovations that occurred over time and their impact on the safety and efficiency of the practice. Bloodletting in rituals and religion. Explore the role of bloodletting in religious and ritualistic practices around the world. Investigate how various cultures incorporated bloodletting into their religious ceremonies, rites of passage, or healing rituals. Discuss the symbolic meanings associated with bloodletting in different religious contexts and its significance in spiritual beliefs. Bloodletting and the spread of diseases. Examine the unintended consequences of widespread bloodletting practices, particularly in the context of disease transmission. Discuss how unsanitary bloodletting procedures might have contributed to the spread of infectious diseases in different historical periods. Explore specific instances where bloodletting may have exacerbated public health challenges. Bloodletting in pop culture. Analyze the portrayal of bloodletting in movies, TV shows, literature, and video games. Explore how this historical medical practice is depicted in popular culture and how it is often used to create dramatic or symbolic impact. Discuss the accuracy of these portrayals and their influence on public perceptions of bloodletting. Each of these story ideas offers a unique angle to explore the history of bloodletting, shedding light on different aspects of this ancient medical practice and its impact on society, medicine, and culture. Thanks for watching. Request you to subscribe the channel.